doctors or the key general physicians of that cities are also very important. Whenever we combine it with something meaningful on ground, that's where people tend to connect. Instead of just, putting another content on the social media. So, for example, we did this with Delhi Metro, collaboration with Delhi Metro. It was a no tobacco campaign. We are also saying that it's not about illness, but about wellness, right? So, it's not about that transactional hospitalization moment, but it is about a total life journey.
Hello and welcome to the SG Brand Leadership Series, a series of one-on-one interactions with top brand and marketing leaders who share their industry insights and strategies that have helped shape their stories. Today we are joined by Dr. Ritu Mittal Garg, Chief Growth and Innovation Officer at Fortis Healthcare. With an illustrious background that combines medicine and business, Dr. Garg brings a unique lens to healthcare strategy. She is an ENT surgeon by training with an MBBS and MS from Lady Hardinge Medical College and an MBA from the Indian School of Business. In her current role at Fortis, Dr. Garg is driving the growth agenda by blending innovation with execution. From launching the Fortis Institute of Genomic Medicine to expanding super specialty OPDs across India, she's redefining how a legacy healthcare brand grows while staying patient-focused and future-ready. Welcome, Dr. Garg. Let's dive right in. They say doctors save lives and MBAs make PowerPoint decks. But you seem to have mastered both worlds. Did this unique career path happen by accident, or was it part of the grand plan all along?
It was by accident, clearly. I think, after 12 years in med school, I was just at home for a break. It was actually my mat leave and I was just thinking what to do. And I happened to meet somebody who was pursuing MBA from Indian School of Business. It seemed quite interesting to me. Also, that was the time when, there was a lot of M&A, Fortis had acquired Vocard. It was all over the news. And I just felt that as a clinician, maybe there is a way to make a bigger impact. And I just took a GMAT, just got great scores and applied only for one school, got in through it, and rest is history.
I'm not too sure whether ISB would want you as a brand ambassador, saying you were able to crack it just because you were thinking, okay, spare time mein kya karna hai? And you were able to crack it, really? Congrats. I mean, that's something. So it was kind of by both chance and design, right?
Yeah, started by chance. Once path became visible, then I guess I kind of converted that into a design and it's okay, let's just change the path.
So what do you enjoy more, the OPD or do you enjoy the Excel sheets and the decks?
I just enjoy being connected to healthcare. So I would have loved being a clinician as well. But I do feel that as a clinician, you impact maybe one patient at a time. And over the years, I've realized that you can actually make a bigger impact by not necessarily doing it for one patient, but for a larger one.
Interesting. So a surgeon by training and a strategist by choice. You are someone who knows how to operate in the OT and in the boardroom. How do you combine clinical knowledge and strategic thinking to shape brand narratives?
Very interesting. So I think as a clinician, there is an innate understanding of what patients are looking for, right? I think that humane touch in a way which probably is kind of, missing sometimes these days. Yet, you've been dealing with human lives for a long time and you understand what the patients need. I think everyone is looking for transparency, honesty, clarity, and outcomes.
Right.
Now, as a strategist or as a brand leader, then, converting that need and bridging the gap of what clinicians wants to say becomes an easy task, right? So how do I break the complex medical information? How do we convert this scientific accuracy into something more strategic and simple to understand? And as a clinician, I think it's a little easier to bridge that gap.
So you do understand from both aspects, right? As a medical practitioner, plus as a marketer. So you do understand both aspects. It helps you, I'm assuming, drive better narratives, better strategies.
Yes, it does. It does. Because I understand what the healthcare delivery is all about. I also understand what clinicians are going through. Sometimes clinicians are not able to express what they want to say. Sometimes it gets a little bit more clinical and little bit not empathetic, and then how do we convert that into something in an empathetic manner to which a layperson understands. I think that gets better over time because you've seen both sides.
True.
And then it's a little bit easier to build that narrative. Our narrative is built around empathy because frankly there is no one as empathetic as doctors are. Now sometimes it's not perceived that way simply because the volume of work is pretty high. There's always one patient after another, so you may not be able to articulate it that much, but the brand itself is speaking their language through what they feel, what they do in a language that people understand.
True, very true. Also, as the Chief Growth and Innovation Officer at Fortis, what are those key growth pillars that you focus in today's ever-evolving healthcare industry?
Yeah. So I think at Fortis, we would like our strategy to be centered around patient-centric innovation. What it essentially means is deepening our clinical programs. So we want to make sure that whatever is there, which is best in the world for patients across specialties, is with us. And that is a very significant growth strategy. And then new care models, so whether on oncology, genomics, mental health, preventive health, while also expanding our capacity to be able to serve more number of patients.
Right.
I think those are 3-4 things, that define our growth strategy.
Right.
Be accessible, be there, where patients need you, provide them with what is best available, and do it with empathy and not just illness, but wellness.
That's a fabulous thing. You spoke about empathy, and I know I was discussing this earlier with you. Empathy, a word which most as patients would want from doctors, from an hospital that they visit. It's unfortunately in competition doesn't happen. At Fortis, I've seen that happening. Has there been a special, I don't know how to say, a skilling session that's happened with doctors where you've told them that empathy is the key feature or the key thing that needs to be highlighted, as in when the patient, how do you ensure that it gets embedded in the core DNA of every employee or every consultant that's associated with Fortis?
I think empathy needs to be part of our culture. And that has different facets to it. I think one is also starting from the top. So, our managing director, CEO, senior leadership, CEO, the fact that they need to display empathy towards employees. And that's when the employees feel empathetic towards their patient, right? So you have to make sure that employees, feel heard. I think that's one part of it. Also, the structured way of communicating that empathy is a very important pillar. So yes, we have got a very strong learning and development program, and we run programs not just to doctors but across. So right from the security guard to the front office, receptionist, billing, nursing. So there are multiple programs, skilling programs that we run for all our employees, and empathy is a very, very significant theme out of it.
All right.
In fact, interestingly, we recently had our leadership offsite, and one of the exercises was, there was a jigsaw puzzle. Okay. And we were all divided into different groups, and as different groups, we were supposed to put that puzzle together. And when we were putting that puzzle together, it was about a patient's journey into the hospital.
Okay.
And, how do patients feel when they come in, when they get to a desk, how are they feeling? Right. How difficult sometimes it is to navigate the complex system. And once we put that together, it was like a comic storyboard. And that's when, you reflect and you think that, at every place, if we had, or the person there had responded differently, how would it have felt? I think it was an eye-opening exercise, and it was all the top leaders of the company. And when they experience it themselves, that's when they go back and talk to their teams and inculcate. So it's about building that into culture. We're not there yet. I think we still have a lot of room to do, but I can tell you that it is talked about almost every day in every meeting.
All right. That's great to hear. In fact, you did mention about genomics.
Yes.
I have a question there. With the launch of the Fortis Institute of Genomic Medicine, that was a major milestone, right? How are you positioning this offering and to differentiate Fortis in the competitive healthcare space?
Yeah, to me, genomics is fascinating. I've been reading about it all along. And the fact that two people with the same disease on the same medicine are going to react differently simply because their genetic makeup is different is something that sinks in when you really think about it. So as we foresee it, I think genomics is not going to be a siloed one department. To us, it is about integrating it into a clinical workflows and make sure that it is across the spectrum. So preventive, predictive and personal. That's what genomics is. So let's say if there is a patient with heart disease and the patient walks up to the cardiologist, right? So there's a battery of tests that people do. There's a certain way of transactional way of dealing with that problem. So, you've come with the pain, I have to sort out the pain.
Right.
But when you go deeper and understand who you are as a person, what your genetic makeup is and why are you suffering from that pain and how will this evolve over the years, not today, not for next week, but over the years, I think the conversation is very different and very powerful. So what we are working towards is, and it's a very significant pillar for us for next 5 years. We've actually made a roadmap of where we want to be in genomics. We want to make sure that it is integrated into our everyday workflows. We are able to explain it to our patients. We are able to diagnose, what to expect,
Right.
how to prevent, and how to get the best outcome for a treatment based on someone's genetic makeup.
So how do you make something as complex as this relatable for a layman?
I think it is again about breaking this complex information into smaller snippets that people can understand.
Right.
So what we've also realized that conversations like this, right, work better than monologues. So instead of a doctor coming and saying, this is what genomics, this is what looks like, I think talking with lived experiences, sharing stories, breaking it down into what genomics is, and talking about case studies, that's when people begin to realize the power of it.
Yeah, very true. I'm going to go back because on how do I say it's something beyond say empathy now. In a sensitive, healthcare overall is a sensitive category. Now, how do you approach brand storytelling so it feels authentic, reassuring, and at the same time non-transactional?
Yeah, it has to be based on trust and empathy. I think trust, empathy, and lived experiences. So whenever people see the communication from a brand like a healthcare brand, I think it should not be about selling. It should be about empowering them with something. Like one of the campaigns I can talk about. So we did a campaign on breast cancer awareness program. And what we did was a very simple video which charted a day of a woman and how minutes are spent, right? 20 minutes getting ready, 20 minutes packing children's lunch, 20 minutes video, 20 minutes TV, so on. And how by the end of the day you realize that everything else gets prioritized except one's own health. And when you look at it as to how the minutes have gone, and we're not able to take out that 10 minutes for a self-breast exam, which can make all the difference. Not to herself only, but to the entire family. And then we narrated it that way. And when I looked at it as a woman first, I think it felt very personal and it felt very relatable. and reassuring, because we ended up with a breast exam to say, okay, after all this, just take out 10 minutes. And, there was a video, an educational video. So I think the communication has to be honest, it has to be educational, and it has to be rooted in empowering people.
Interesting. So, when you're talking about communication, today the audiences, the customer that you have, the patients you have, they're all digital first, I would like to call them, right? So, what are your innovative or differentiated marketing tools or platforms that you've kind of adopted to ensure that your communication reaches to the audience who's digital first in nature?
So I think just like everybody, social media, of course, plays a different role. And we've also realized there are different kinds of audience for different social media, right? So the communication on, let's say, Facebook is very different than what it is on LinkedIn or Instagram. And, you also very interestingly have different age groups in our teams. Like I know very little about Instagram. I maybe know a little bit more about LinkedIn. But I have, younger people who know nothing about Facebook. They're actually not on Facebook any longer. They're Insta kids, right? So the communication is different for each of the platform. But more importantly, what my understanding is that, in this era of too much content, reels, it's not easy. And again, the authenticity comes in. So what we've realized is that whenever we combine it with something meaningful on ground, that's where people tend to connect. Instead of just, putting another content on the social media. So for example, we did this with Delhi Metro, collaboration with Delhi Metro. It was a no tobacco campaign. Again, educational, honest, nothing, no selling, nothing.
Right.
And then there was a team which was present in all metro stations. And we are very grateful for DMRC, for doing this collaboration. And they were all wearing those t-shirts. And, it was a very powerful campaign on where are you, on no smoking and, cut tobacco campaign. And I think it just garnered a lot of interest again, because it was right in that moment. It was on ground. It was very structured because you had people across all metro stations at once. So you get into the train, you get out of the train, it's the same messaging with on-ground people who are talking about how to quit tobacco. Again, also sharing helplines, also sharing, government authenticated and not necessarily our branded material there to help and support people. I think it's just that, be honest, empower them, and ensure that, it's for their benefit.
Very true. So, interestingly, in a country as large and diverse as ours, and as you expand further, you'll get into tier 2, you're already there in some cases, tier 2, tier 3 towns, right? So the healthcare needs from city to city differ. As a city dweller will have different kind of priorities in terms of healthcare vis-a-vis someone who's in, say, a tier 2 or tier 3 town. So how do you ensure that your brand messaging, one, has some kind of a uniformity, because you'll have to do that, but at the same time gets adapted to communication that's suited to a particular target audience?
Yeah, so I think brand value promise remains the same.
Right. Obviously.
It's the tone as well as the context and the cultural connect which changes. So we go heavy on vernacular. I'm personally also believe that it's very important to connect to the people on the ground. So we would prefer to do a vernacular. So let's say when we are in Maharashtra for our Bombay hospitals, Marathi becomes important. Karnataka, it's a different language. Bangla for our Calcutta hospitals, Punjabi. So I think, one is that context. Another is even the messaging sometimes needs to be simpler. I think, again, when you go to tier 1, tier 2, it is about trust, also the accessibility and personal connect. We don't want to come across an intimidating hospital with fancy building, faceless, with, lots of big machines where you get lost. That's not who we are. At the end of the day, behind all of this, there are people who are approachable, they are accessible, they are there to handhold. And I think that's the messaging then that becomes more important. Who do I reach out to so that they don't get lost?
As a marketer, now I'll ask the question. How do you measure, or what kind of tools do you use to kind of gauge the impact of a campaign that you've designed and just executed?
Well, that's a difficult one because I do feel that, there is some tangible but a lot intangible.
And I'm talking beyond footfalls and revenue,
Yes.
by the way.
Yes. So, it's tangible and intangible. To me, tangibles are easy ones, right? That anybody does. So, sentiment analysis, engagement rates, views, all of that is there. But frankly, more importantly, sometimes it's just the, human brand connect that you just get to know. So, whenever I talk to my teams and I'm like, okay, how's this campaign doing? And they'll say, yeah, the stats look good. And I'm like, no, but nobody has, given me a message saying they heard it and they liked it. And to me, getting that from a third party, or a second or a third degree separation means a lot. If there is something and I've got a relative sitting, in some part of India or across and saying, oh, I looked at your ad, it seemed pretty interesting. To me, sometimes that's more powerful than, some of these statistics. Yeah. Similarly, sometimes the doctors would say, oh, you ran that campaign. Why wasn't I part of that? And I'm like, okay, fine, that worked. So sometimes, these human brand connect that becomes more important. Numbers we analyze anyway, but for me, it's always been more about, the intangible, and over time this compounds. That's how the brand goodwill, kind of builds. And you don't see it in a month, in a year. I think you see it over the years. And over the years, what is it that people are talking about? Fortis. And I'm very glad to say that we have experienced that change. And that doesn't come from one section. That comes from our partners, from our supply chain, from insurers. It's 360. And then you get to know something is right. And then, of course, there are things that, we need to continuously work on.
Also, Fortis has been investing heavily in eICU setups, right? Digital OPDs and regional clinic expansions. So how does marketing support these new growth sectors?
Same. So these are some of the things that we try. Not always we are successful. We go in thinking that, there is a need for that. So eICU is run by one of our clinicians who's very passionate about it. And we've seen very good impact and, what we can do in a smaller nursing homes while sitting in large metros. Similarly for digital OPDs also, I think again, it's about communication and making the process simple, and then communicating it either through the key opinion leaders of that small city. Sometimes that works also.
Right.
In our kind of an industry, doctors or the key general physicians of that cities are also very important, because typically even now, let's say if you need a medical help, you tend to talk to your family doctor and ask, where do I go? Does it make sense? So even communicating to them is a very critical part of it. And we spend significant time and effort making sure that they understand what do we do, that, we are accessible to them. They can reach out to us, anytime that they want, because they are the key opinion leaders and the people who guide within those micro ecosystems. So direct communication through vernacular activities. So we've also at times done cyclothons or events,
Right.
even collaborated with local government. So again, one of the cancer awareness, we collaborated with Highway Authority of India. We illuminated some of the toll plazas just for spreading awareness. In Srinagar, we did this Dal Goes Pink. So entire Dal Lake was illuminated pink in support of breast cancer awareness, or Qutub Minar. So these are some of the things that we do even in smaller cities for their iconic monuments, or such to partner with them.
You worked across clinical roles and corporate strategy. What mindset shifts were required when transitioning into a leadership role that spans marketing, innovation, and growth?
Well, I think the biggest shift is from a doer to an enabler. from, just doing it yourself to creating an ecosystem and supporting people. So, now it's about listening more. It's about connecting the dots across different functions, aligning the stakeholders, and creating the systems and processes for people to do it at scale. That's the shift.
Then how do you cultivate innovation internally, especially in a sector where trust, compliance are very critical?
So we set off on this innovation journey. Very interestingly, I don't think there are many organizations which have innovation as a vertical, but we do. So I'm very lucky that the organization believes in that. I'm personally very passionate about it. So we do quite a few things actually. So we started running some innovation challenges, which were structured innovation challenges for nurses, for doctors, and for everybody else, where we just open it up for everybody to just think differently and share what they want to do. And some of the very interesting ideas came to us. And again, the final rounds were done by the top leadership, including the CEO. That kind of sets a messaging around that we want people to think differently. We want people to put on their innovative, hat and experiment and try. Of course, there is a guiding framework to ensure the trust as well as compliance is met. Interestingly, we are also part of IHH, based out of Singapore, right, as a parent company. IHH recently ran a sandbox in which they have actually funded teams who have come up with innovative ideas, and 4 of Fortis projects got funded from Singapore directly and they were very interesting apps. So one of the nursing teams from one of the hospitals in Bombay said that we get a lot of questions around insulin. It's a very simple thing, right? I mean, diabetes is rising, a lot of people are using insulin, and there is a lot of training that needs to go for an attendant, what to use, how to use, lots of questions. So while they try and do that, people forget. So they said, why don't we create an app on insulin? Now, I thought that was a very powerful idea, and they did some prototyping at Sector. They won the grant, and right now they're working on it. Similarly, there are 2-3 others, very interesting ideas that people have come up with. So now we are not just saying it as a lip service that, you go innovate. So we are giving them time, we're giving them resources, we're giving them guidance, and we're giving them funds to, again, go experiment, see what you think that we can do differently.
Interesting. Come another month or so, we'll hit the festive season. With the festive season come a whole bunch of other healthcare issues that'll crop up. Just being, the perfect marketing person that you will be, I mean, that's one revenue churner for sure. But tell me, how does, say, festive marketing this year, what are the plans? And do any of your past, say, festive marketing campaigns that you've conducted so far, any that stands out?
So, for us, it's a very delicate month, right? Everybody's celebrating, you don't want to go and say, oh, don't eat this, don't eat that, and yet you want to subtly send a message, just be careful, just be careful, don't overdo this, don't overdo that. So, we build campaigns around that, but more importantly, let's say there's Rakhi, right? So, we've started saying that you take care of the person that you love and you give them wellness. So for us, as I was saying that, we are also saying that it's not about illness, but about wellness, right? So it's not about that transactional hospitalization moment, but it is about a total life journey for yourself and the people that you love. So our campaigns are centered around preventive care largely, to say that, if there is like a Mother's Day, then we say, okay, I hope she's got a mammogram done. I hope she's got a pap smear done. It's time that maybe it's a good day to just make sure that she remains healthy. Similarly for Rakhi protection, right? How do you protect a brother or a sister, by making sure that they're healthy. So our usual campaigns are built around that. And yes, there are times that we've seen a very significant response to that.
So any of the recent ones that you remember recall?
So I think it was Rakhi last year. Again, we did this. So we said that, you walk into any of our hospitals during a Rakhi day and you get a complimentary or a, significant discounted for your sister or brother. And there was a significant traction over it. Yes.
Interesting. You've also worked with the Hindustan Times Group. So how was your experience in terms of audience relevance, campaign execution, and the platform's ability to bring your brand story to life?
Oh, very nice. I think we've done a couple of campaigns. It was one on car seat and others as well. Hindustan Times has been, one of the iconic media houses, of course, and talented people like you make that happen for us. So I think what I like is the collaborative spirit. I like the fact that, open to ideation, brainstorming, and then going for execution is great. So we really enjoyed working with Hindustan Times.
Dr. Garg, this has been insightful. But before I end, I would love to ask you this. When I was preparing for this discussion, I went through your social media profile just to understand who you are. But that's, I guess, open for anyone who's trying to study you. Tell us something which your social media profile doesn't talk about.
Oh. So, while social media is a lot about my professional life, of who I am, and I'm very passionate about healthcare. I just love it. But on a personal front, I love to travel. I love to be with my kids, with my family. I mean, that's my guarded time. So whenever I get an invite for a Sunday morning, I'm like, no, that's my kids' time. I want to be with my kids. So I love that, and I love traveling. I mean, that's one thing that, just keeps me alive.
Thank you so much, Dr. Garg, for that thoughtful, inspiring conversation. It was a pleasure to have.
Thank you. It was a pleasure. Thank you so much.
Most welcome.
Thank you.
Thank you, Dr. Garg, for that thoughtful and inspiring conversation. Your approach to combining growth with innovation without compromising on trust or care offers a great blueprint for marketers across industries. That wraps up this episode of the HT Brand Leadership Series. Stay tuned as we continue to bring you stories from India's most forward-looking brand leaders. This is Aman Kanjlia signing off.